The blood on Dr. Maya Chen's desk wasn't supposed to be there. Neither was the patient sitting across from her, calmly wiping his hands with her tissue box, smiling like he'd just told her the weather forecast. "I'm sorry about the mess," he said, his voice smooth as silk. "Sometimes these things just happen." Maya's heart hammered against her ribs as she stared at the crimson stains spreading across her appointment notes. 3 years of clinical psychology training had never prepared her for this moment. The man before her, David Kellerman, according to his file, had walked into her office for a routine psychological evaluation. Court-ordered, the papers said. Nothing more than a standard assessment for his upcoming custody battle, but David wasn't standard. Nothing about him was standard. "Mr. Kellerman," Maya managed, her voice steadier than she felt, "how exactly did you injure yourself?" His laugh was musical, almost pleasant. "Who said I was injured?" The words sent ice through her veins. Maya glanced toward the door, calculating the distance. 15 feet, maybe 20. Her hand moved slowly toward the panic button beneath her desk, a precaution she'd never imagined using. The button that would summon security, that would bring help. That would. "I wouldn't do that if I were you," David said conversationally. "Not yet, anyway." "We're just getting to the interesting part." Maya froze. Her eyes met his, and what she saw there made her blood run cold. Not anger, not madness, not even malice. Just emptiness. Like staring into a well with no bottom. "You study people like me, don't you, Dr. Chen?" David leaned forward, his elbows resting on his knees. "You have all those fancy tests, those questionnaire. The hair psychopathy checklist, the Minnesota multiphasic personality inventory. Tell me, how am I scoring so far?" Maya's mouth went dry. She'd administered the PCLR countless times, but never under these circumstances. Never with blood still wet on her desk and her patient speaking like he'd read her mind. "I think," she said carefully, "we should reschedule this appointment. You seem to be having some sort of medical emergency." "No emergency," David interrupted. "Just a demonstration. You see, Dr. Chen, I've been looking forward to meeting you. Your reputation precedes you. The young prodigy who can spot a psychopath from across the room. The woman who's never been wrong about a diagnosis. Maya's reputation was exactly what had landed her this case. At 28, she was the youngest psychologist ever to join the state's forensic evaluation team. Her ability to read people, to see through their masks and manipulations, had made her invaluable to the court system. Judges requested her specifically. Attorneys feared her testimony. She'd never encountered a case she couldn't crack. Until now. "The blood," she said, forcing herself to focus on the immediate threat. "Whose is it?" David's smile widened. "Does it matter?" "The real question, Dr. Chen, is whether you can pass my test." He reached into his jacket pocket, and Maya's entire body tensed. But instead of a weapon, he pulled out a manila envelope. "Inside this envelope are 3 photographs. 3 people I've encountered recently. Your job is to determine which one is still alive. Mr. Kellerman, I'm going to have to ask you to leave. One of them is my ex-wife, Sarah. Sweet Sarah, who thinks she can take my children away from me. One is her lawyer, Mr. Peterson, who's been so helpful in her crusade. And one is my neighbor, Mrs. Henderson, who's been watching my house a little too closely lately. David placed the envelope on the desk, right next to the bloodstains. Choose correctly, and you might be able to save someone. Choose wrong, ... Maya stared at the envelope like it was a snake coiled to strike. Every instinct screamed at her to run, to press the panic button, to do anything except play his sick game. But something else held her back. Professional curiosity warred with terror as she realized she was face to face with the kind of predator she'd only read about in textbooks. Why me? She whispered. David's expression shifted, becoming almost tender. Because you're special, Maya. May I call you Maya? You see patterns others miss. You understand the darkness in people's hearts. And because ... He paused, tilting his head like a curious child. Because I think you might be more like me than you realize. The accusation hit her like a physical blow. Maya had always prided herself on her empathy, her ability to connect with patients, to help them heal. The suggestion that she shared anything with this monster made her stomach revolt. I'm nothing like you, she said firmly. Are you sure about that? Let me ask you something, Maya. When you look at your patients, when you dissect their minds and catalog their failures, how does it make you feel? Powerful? Superior? Do you ever wonder what it would be like to push someone over the edge instead of pulling them back? Maya's breath caught. The question struck uncomfortably close to thoughts she'd never admitted to anyone, barely admitted to herself. The tiny thrill she sometimes felt when she solved a particularly challenging case, when she saw through someone's defenses and laid their psyche bare. Was that normal professional satisfaction, or something darker? The envelope, Maya, David said softly. 3 lives hang in the balance, and your choice will tell me everything I need to know about who you really are. Maya's hand trembled as she reached for the envelope. In that moment, she realized that whatever happened next would change her forever. The woman who walked out of this office wouldn't be the same one who'd walked in. If she walked out at all. Maya's fingers shook as she opened the envelope. 3 photographs spilled onto her desk, their glossy surfaces catching the fluorescent light. Her trained eye immediately began cataloging details, but her heart pounded so loudly she could barely think straight. The first photograph showed a woman in her mid-30s with shoulder-length brown hair, lying on what appeared to be a kitchen floor. Her eyes were closed, and Maya couldn't tell if she was unconscious or worse. Blood pooled beneath her head, dark against the white linoleum. The second image depicted a middle-aged man in an expensive suit slumped over his office desk. His briefcase was open beside him, papers scattered everywhere. His face was turned away from the camera, but Maya could see his chest wasn't moving. The third photograph made her gasp aloud. An elderly woman sat in what looked like her living room, but something was terribly wrong. Her eyes were wide open, staring directly at the camera with an expression of absolute terror. Unlike the others, she appeared to be alive, but bound to her chair with rope. Interesting choices, aren't they? David's voice cut through her analysis. Each one presents a different scenario. Sarah's injury could be survivable. Head wounds bleed extensively, but aren't always fatal. Mr. Peterson appears to have suffered some kind of medical emergency, though appearances can be deceiving. And dear Mrs. Henderson, go quotes, he chuckled. Well, she's clearly very much alive. For now, Maya forced herself to examine the photographs more clinically, pushing down her emotional response. This was what she did: read people, understand their motivations, predict their behavior. But she'd never applied these skills with someone's life literally hanging in the balance. "You want me to choose who lives," she said, not looking up from the images. "Oh no, Maya, I want you to choose who dies." David's correction was delivered with the casual tone of someone discussing lunch plans. "You see, one of these three people is safe. The other two, well, time is running out for them." Maya studied David's face, searching for tells, for any indication of deception or truth. His micro-expressions were perfectly controlled, his body language relaxed and confident. Everything she'd learned about reading people seemed useless against him. "This is psychotic behavior," she said, trying to maintain her professional demeanor. "This level of manipulation, the complete disregard for human life, you're exhibiting classic symptoms of antisocial personality disorder with psychopathic features." "Very good, Dr. Chen, though I prefer to think of it as clarity. I see the world without the fog of emotion that clouds most people's judgment. I understand what people really are beneath their pretenses." David leaned back in his chair. "But we're not here to discuss my diagnosis. We're here to discover yours." "What do you mean?" "Every choice reveals character, Maya. Save the wrong person, and you're responsible for 2 deaths. Save the right person, and you've successfully participated in murder. Either way, you cross a line you can never uncross. The question is, what kind of person does that make you?" Maya's mind raced. Was this some elaborate psychological experiment? A test of her moral boundaries? She couldn't shake the feeling that David was studying her reactions as carefully as she was studying his. "The woman," she said suddenly, pointing to the first photograph. "Sarah, your ex-wife. You want me to choose her because you think I'll make the emotional choice, save the victim I can most easily empathize with. A woman fighting for her children." David's eyebrows rose slightly. "Interesting theory, but that's not the right answer, is it? Because you're not actually trying to kill anyone. This is all an elaborate manipulation designed to see how I respond under pressure, to see if I'll abandon my ethical principles when faced with an impossible choice. You sound very certain of that assessment." Maya felt a flicker of her old confidence returning. "I am, because despite your claims of being a psychopath, you've shown several indicators of concern for consequences. You apologized for the blood on my desk. You're conducting this elaborate scenario instead of simply attacking me directly. A true psychopath wouldn't bother with such complex psychological manipulation when simpler methods would suffice. David's smile faltered for just a moment, so briefly Maya almost missed it. But she'd been watching for exactly that reaction. So my diagnosis, she continued, gaining momentum, is that you're not a psychopath at all. You're someone with narcissistic personality disorder, possibly bipolar, acting out due to stress related to your custody battle. You're seeking attention and control, but you're not actually dangerous. The silence that followed stretched for what felt like an eternity. David sat perfectly still, his face unreadable. Maya felt a surge of professional pride. She'd done it again, seen through the performance to the truth beneath. Then David began to laugh. It started as a quiet chuckle, but quickly escalated into full-blown hysteria. He doubled over, clutching his sides, tears streaming down his face. Maya's confidence evaporated as quickly as it had returned. "Oh, Maya," David gasped between fits of laughter. "Oh, you brilliant, naive, wonderful woman. You almost had me convinced for a moment that you really were special. But you've just proven you're exactly like everyone else." He wiped his eyes and fixed her with that empty stare again. "You want so desperately to believe in your own safety, in the orderliness of your world, that you'll convince yourself the blood on your desk is fake, that the photographs are staged, that the monster sitting across from you is just a troubled man having a breakdown." Maya's mouth went dry. "The blood ... it's real. As real as the timer that's counting down in 3 different locations right now." David checked his watch. "You have 6 minutes to make your choice, Maya. 6 minutes before I send a text message that determines who lives and who dies. And if you don't choose ... double quotes," he shrugged. "Well, then you've chosen all 3. The photographs seemed to burn on Maya's desk. She looked at them again, this time noticing details she'd missed before. The time stamp in the corner of each image showed they'd been taken within the last hour. The blood was bright red, fresh. The terror in Mrs. Henderson's eyes was too real to be acting. "You're lying," she whispered, but even she could hear the doubt in her own voice. David pulled out his phone, thumb hovering over the screen. 5 minutes and 30 seconds, Maya. Clock's ticking. Who lives? Who dies? And what does your choice say about the person you really are?" Maya stared at the photographs, her carefully constructed world crumbling around her. Everything she thought she knew about reading people, about understanding human nature, seemed worthless in the face of this impossible situation. She was about to discover something about herself she'd never wanted to know. Maya's hands shook as she studied the photographs again, but this time she forced herself to think like the forensic psychologist she was trained to. Details, evidence, patterns. There had to be something she was missing, some clue that would reveal the truth. 4 minutes, David announced casually, as if he were timing a parking meter. "Wait," Maya said, her voice steadier than she felt. "You said one of these people is safe. That means you haven't heard all 3. Why show me the safe person at all? What's the point? David's expression didn't change, but Maya caught something, a microsecond of surprise that he quickly masked. She was onto something. Psychology 101, she continued, gaining confidence. You're not just testing my moral boundaries. You're studying my decision-making process. The way I analyze information under pressure. Which photograph I'm drawn to first. How I rationalize my choice. Maya set the photos down and looked directly at David. I'm not just a victim in your experiment. I'm the subject. Very perceptive, David acknowledged. But it doesn't change your situation. 3 minutes and 40 seconds. Maya's mind raced through everything she knew about psychopathic behavior. The need for control, the view of others as objects to be manipulated, the complete lack of genuine empathy. But also their weaknesses, narcissism, the need to feel superior, the compulsion to prove their intelligence. You made a mistake, she said suddenly. Did I? The blood on my desk. You said, sometimes these things just happen, but psychopaths don't believe in chance. Everything is calculated, controlled. You put that blood there deliberately as part of your psychological theater. Maya stood up slowly, moving around her desk. But why fake the blood if the photographs are real? Why start with a lie if you want me to believe the truth? David's eyes followed her movement, but he remained seated. Perhaps I wanted to see how you'd react to evidence of violence. Whether you'd run or stay and investigate. No, Maya shook her head. That's not it. You wanted me to doubt myself, to question my ability to distinguish between what's real and what isn't. Because once I start doubting my own perceptions, I become easier to manipulate. She moved closer to the window, increasing the distance between them. The photographs aren't real either, are they? They're staged. Probably people you hired. Theatrical makeup for the blood. Photo editing for the timestamps. David's smile never wavered, but Maya noticed his hands clench slightly. Another tell. 2 minutes and 30 seconds, Maya. Even if you're right about some details, are you willing to bet 3 lives on your theory? That was the hook. Maya realized with sudden clarity that this entire scenario was designed to exploit her greatest strength, her confidence in reading people, and turn it into a weapon against her own moral compass. David had studied her just as carefully as she studied her patients. He knew exactly which psychological pressure points would cause maximum damage. You know what I think? Maya said, reaching for her office phone. I think you're right about one thing. I am more like you than I want to admit. We both manipulate people for a living. The difference is, I help them heal afterward. What are you doing? Calling your bluff. Maya began dialing 911. Because a real psychopath wouldn't waste time on elaborate psychological games when they could achieve their goals more efficiently. You're performing for me because you need my validation. You need me to be afraid, to be impressed by your intelligence, to see you as the predator you want to be. David stood abruptly, his calm facade cracking for the first time. Hang up the phone, Maya. Or what? You'll hurt me. With what weapon? You haven't shown me anything more dangerous than photographs and your own delusions of grandeur. Maya kept dialing, even as her heart hammered against her ribs. She was gambling everything on her read of his psychology. You don't understand, David said, and for the first time, Maya heard something unexpected in his voice. Not anger or threat, but desperation. I need you to choose. I need to know what you'll do when everything is on the line. The confession hit Maya like a revelation. This isn't about the people in the photographs at all. This is about you. You're not testing my moral boundaries. You're trying to find your own. David's hand moved toward his jacket pocket, and Maya tensed. But instead of a weapon, he pulled out another photograph. This one showed a young boy, maybe 8 years old, with David's eyes and a woman's gentle smile. My son, David said quietly. Thomas. He lives with Sarah now, and after the custody evaluation, I might never see him again. The court psychologist is going to testify that I'm an unfit parent, that I'm dangerous. Maya understood then. The elaborate setup, the psychological manipulation, the desperate need to prove his intelligence and control, it was all the behavior of a man who was terrified of losing the one thing he actually cared about. You're not a psychopath, Maya said gently, hanging up the phone. You're a father who's scared of losing his child, and you're acting out in ways that are only going to make things worse. David's carefully constructed mask finally crumbled. The court says I have antisocial personality disorder. They say I can't form genuine emotional attachments. But Thomas ... His voice broke. I love him more than my own life. How can I prove that to people who've already decided what I am? Maya looked at this broken man and saw not the monster she'd feared, but a deeply damaged person who'd confused intelligence with emotional control, manipulation with connection. He wasn't dangerous. He was desperate. The photographs, she said gently. They're not real, are they? David shook his head, looking suddenly very young. Stock photos, makeup, I just ... I needed to see if you'd choose to save someone, if you'd risk everything for a stranger. Because if you could do that, maybe there's hope that I can be the father Thomas deserves. Maya felt a wave of compassion mixed with professional concern. David, you need help. Real help. Not games or tests or manipulation, but genuine therapy. For Thomas's sake, if not your own. David nodded, tears streaming down his face. I know. I just ... I don't know how to be anything other than what I am. How to connect with people without controlling them. How to love someone without consuming them. Maya realized she was looking at the real test, not of her moral choices under pressure, but of her ability to see the human being beneath the pathology. To help someone who'd wrapped himself so thoroughly in psychological armor that he'd forgotten how to ask for help. We start here, she said. We start with the truth. And we figure out how to get you the help you need to be the father Thomas deserves. For the first time since he'd entered her office, David's smile looked genuinely grateful instead of calculated. Maya knew the real work was just beginning. 6 months later, Maya sat in the same office, but everything had changed. The bloodstains were long gone, replaced by new furniture and a fresh coat of paint. The terror that had consumed her that day had transformed into something unexpected, a deeper understanding of the human capacity for both darkness and redemption. David Kellerman sat across from her again, but this time he was there by choice. His court-ordered evaluation had led to supervised visits with his son Thomas, and Maya had become his therapist. The man who had once terrified her with elaborate psychological manipulations now struggled to express basic emotions without falling back into patterns of control and manipulation. "He drew me a picture yesterday," David said, holding up a crayon drawing of two stick figures holding hands. "It's us at the park." He wrote "My Dad" at the bottom. His voice cracked with genuine emotion, something that had taken months of therapy to access. Maya smiled, remembering the frightened, desperate man who had staged an elaborate psychological experiment just to test whether genuine human connection was possible. "How did that make you feel?" "Terrified," David admitted. "Happy, confused, like I might mess it up somehow." He paused, studying the drawing. "I never learned how to love someone without trying to control them. My parents, my ex-wife, even Thomas, I thought manipulation was connection. I thought if I could predict and control someone's responses, that meant I understood them." Maya nodded. She'd seen this pattern in many patients, people who had learned early in life that emotional vulnerability meant danger, so they developed elaborate psychological defenses. The difference was that David's intelligence had made his defenses particularly sophisticated and destructive. "But you're learning," she pointed out. "Every week you come in here and work to understand yourself better. That's not the behavior of someone incapable of change." David was quiet for a long moment. "I keep thinking about that day 6 months ago, what I put you through. I could have just asked for help. Could have told you I was scared of losing my son. Instead, I created this elaborate scenario to test whether human compassion really existed." Maya remembered her terror vividly, but she also remembered the moment she'd recognized David's humanity beneath his pathology. "You were testing yourself as much as me. You needed to believe that connection was possible before you could risk asking for it. I almost destroyed everything that mattered to me," David said. "If you hadn't seen through the performance, if you hadn't been willing to help me ... double quotes." He shook his head. "I would have lost Thomas forever." Maya leaned forward. "But I did see through it. And you did ask for help. And Thomas drew you a picture yesterday. You can't build a relationship with your son based on fear of losing him. You have to trust that love, real love, is stronger than your need to control everything." David nodded, but Maya could see the struggle in his eyes. Learning to be vulnerable after a lifetime of emotional armor wasn't easy. Some days he made remarkable progress. Others, he reverted to his old patterns of manipulation and control. But he kept showing up, kept trying, kept choosing to be better for his son. "The custody hearing is next month," David said quietly. "Dr. Harrison will testify about my progress in therapy, but ultimately it's up to the judge. I might lose him anyway, Maya had been dreading this moment. Despite all of David's progress, the legal system moved slowly, and judges were conservative when children's safety was involved. David's initial psychological evaluation had been damning, and his stunt in her office, even though no one had actually been harmed, had only reinforced concerns about his stability. "Whatever happens," Maya said carefully, "you've changed. You're not the same man who walked into my office 6 months ago. Thomas will always be your son, regardless of custody arrangements. And you'll always have the capacity to be the father he deserves." David's eyes filled with tears, another sign of progress. 6 months ago, he would have viewed crying as weakness, as loss of control. Now he was beginning to understand that emotions weren't weapons to be wielded or vulnerabilities to be hidden, but simply human experiences to be felt and processed. "I love him," David said simply. "Not the way I thought I loved people before, not wanting to possess them or control them or make them need me. I just love him. I want him to be happy and safe, even if that means spending less time with me." Maya felt a wave of professional satisfaction mixed with genuine affection for this complex, damaged, ultimately redeemable man. "That's what real love looks like, David. It's not about what you get from someone. It's about what you're willing to give them." 3 weeks later, Maya received a phone call from David. The judge had awarded him joint custody, conditional on continued therapy and supervised visits that would gradually become unsupervised as he demonstrated stability. It was more than he dared hope for. "I couldn't have done this without you," David said. "That day in your office, when you chose to see me as a person instead of a monster, that changed everything." Maya smiled, thinking about all the patients she'd helped over the years, all the minds she'd analyzed and diagnosed and treated. But David's case had taught her something new about the power of genuine human connection, about the difference between clinical detachment and compassionate engagement. "We all have the capacity for both darkness and light," she told him. "The choice of which one we feed, which one we allow to guide our actions, that's what makes us human." After she hung up, Maya sat quietly in her office, thinking about the nature of healing and redemption. She'd started that terrifying day believing she could read anyone, predict anyone, diagnose anyone from across the room. She'd ended it learning that sometimes the most important thing a therapist could do was simply witness someone's humanity and refuse to give up on their capacity for change. The blood on her desk had been fake, but the fear she'd felt was real. The photographs had been staged, but David's desperation was genuine. And sometimes, Maya reflected, the line between truth and fiction mattered less than the courage to keep trying to connect with another human being, especially when it seemed impossible. Maya looked out her window at the city beyond, thinking about all the David Kellermans out there, people struggling with their own darkness, wondering if change was possible, afraid to risk genuine connection. Her work would continue, one patient at a time, one breakthrough at a time, one moment of human recognition at a time. Because that was what healing really meant, not the elimination of pain or pathology, but the courage to remain human despite it all. Ready to dive deeper into the psychology of human nature? Subscribe for more mind-bending stories that explore the thin line between darkness and redemption. Share this story with someone who appreciates psychological thrillers and comment below. What would you have done in Maya's position? Your thoughts could inspire our next tale.